John, Pete.
All right. Good morning, everybody. So good to see your faces. Hi, Sue Miller. Hi, everyone. I can't get everyone on my screen, so whoever I can not see, it's hello to as well. I'm saying hi to only people that come up on my screen. Let me introduce our guest, Dr. Vineeth John. I have a little bio on him I'd like to read. I'll do my best. I just mentioned I put drops in my eyes, so my eyes are a little off. Dr. Vineeth John, MD, MBA, is professor and vice chair for education in the Department of Psychiatry and Behavioral Sciences at the UTHealth McGovern Medical School in Houston, Texas. Dr. John is also the director of the Geriatric Psychiatry section and is actively involved in various educational initiatives directed towards enhancing domain expertise among psychiatry residents. He received his medical training from Christian Medical College in Vellore, India, and completed his residency in general adult psychiatry at Tufts New England Medical Center and fellowship in geriatric psychiatry at the University of Miami-Jackson Memorial Hospital. In addition, he holds an MBA from the University of Pittsburgh Catt School of Business. Dr. John has held positions of academic leadership at the University of Pittsburgh Medical Center, the University of Miami School of Medicine, and the University of Wisconsin School of Medicine as well. From 2010 to 2015, he directed the General Adult Psychiatry Residence Program in the Department of Psychiatry and Behavioral Sciences at McGovern School of Medicine. Over the past decade, he has been studying the effects of disruptive styles of leadership in organizations and presenting his research at the national and international conferences. And that's quite the resume. Welcome, Dr. John.
Thank you, Donna. And thanks to John and Kathy for inviting me here. And thank you, Peter, for going to navigate the chat. I can't multitask, and that's a huge concern for me, trying to sort of get a gauge on what people are trying to say. It's wonderful to see you all. As I was sharing with John and Kathy and Peter, I was in Buffalo till, technically till last year. We had a house in Central Park on Staten Avenue, and your area and your beautiful location is very familiar to me. And for about 2 years, I did the commute between Buffalo and Rochester, which John does on a daily basis, covering 150 miles. So my car put almost 95,000 miles in 4 years. I lived in Buffalo. So with that, I wanted to share my slides. So if you, hopefully it will go without a problem. So yes, this should be it. Can you see my,
Yes.
okay. Is it in a full mode?
Not yet. It's we can see the whole PowerPoint. And now
Okay.
back to that presentation mode, Doctor. Can you go back and change that again?
Okay.
It's showing the two slides at the same time.
Presentation mode. Okay. Give me a second.
Take your time.
How about now?
Great. Perfect. Thank you.
Yes.
Okay. All right. So I was given a broad kind of a opportunity to talk about what we need to be preparing ourselves more from our well-being standpoint during the pandemic. So I titled this talk "Thriving During a Pandemic," or we could also call it "Everything I Know About Positive Psychology in 60 Minutes or Less." So that's another way to look at it, because this is quite a tall order John and Kathy had told me to do, but I'll try to do my best. We all know that these are the most challenging times. These are unprecedented times. Never in our own lifetime we've ever seen something like this. It's a phenomenon which is truly global, and it has led to some radical responses in the past 6 months. Countries shouldering themselves, blocking off the borders, states blocking off their borders. I can't even visit New York from Texas. I probably have to stay quarantined for 2 weeks. Businesses closing down, families separated, loved ones, lives lost, or really seeing the, I would say, impermanence of our lives in such a radical manner. So what has happened is that it has abruptly changed the way we live, the way we looked at life in general. There has been studies in the past about how we could look at disasters, so if and these are interesting studies because when they always talk about a disaster, they talk about something which lasts for maybe a few hours, like a hurricane or something which would have an impact for maybe a week or so in terms of natural calamity. But what we're looking at it is something which is never ever over. So this particular stage where we move from impact and then a certain sense of heroism when people come together, communities help each other, that's called the honeymoon phase. And then when things are still not better, there is a potential for disillusionment. And at some point, there are reactions to what happened probably a year ago, and then comes reconstruction. So this is what you call stages of a disaster. But as I pointed out, in our case, the disaster is still going on. So although there were periods of optimism and enthusiasm, right now, I think we are mixed in with a sense of disillusionment as well. So what happens is when during the time of heroism and honeymoon phase, you don't have too many emotional needs, but as we move into disillusionment, which is what I think the phase we are all in right now, we are needing a lot more emotional support. And part of, I think, this conversation we're having today is leading up to that particular need your leaders have felt in the community. So in another way we could look at it is what we call the cycles of grief. So when we go through grief, we do go through these stages. First time we hear a news or confronted with something extraordinarily devastating to us, there is a phase called denial, where we are confused, we don't process it properly. There could even be a compensatory elation, like not even like thinking it could even happen, shock, fear, all that happens part of the denial, which then leads to a significant level of anger that happened to us personally, and why me, why us? And then comes a certain degree of bargaining, where we are struggling to find a meaning behind this particular loss. As this grief settles, we would be overwhelmed by depression and helplessness. And at some point, much later, we have the phase of acceptance. So I showed you two different cycles, the cycles of disaster and then stages of grief. So I know that, it's sort of the grief would follow sometimes losses through disaster, but we have to be aware that the kind of emotional reaction we are facing right now is that we probably are processing our own grief in our own personal way. So as we are all highly productive professionals, I just wanted to pay attention to some of the challenges you have all faced during this particular time. Our complete life has been topsy-turvy during this time, where we are working alongside our spouses, our kids. Spaces which we chose to live is not the perfect space for having an actual office. And so spaces may not be suitable. When does a personal responsibility end? Where does a professional responsibility begin? It became really blurred during this time. Boundaries of time, people are texting you at all times, hoping that you could help them. And so time boundaries are getting, in a way, softened. Multiple distractions, social isolation. We all have periods of creativity. A lot of people are creative because they could think by themselves. And in your particular business, there are times you're alone or you're driving. All those kind of pockets of luxury you enjoy to stimulative creativity is already gone because of the new arrangements we are forced to confront with during the pandemic. Some people feel burnout. There is a concept called Zoom fatigue after you sit in these meetings after meetings on Zoom. I also heard that some people have something called Zoom shirt, means that they have only one shirt. They hang it behind their chair, and then when they're in for a meeting, they wear that shirt. And there was some record of some guy wearing the same shirt for 30 days nonstop. So all these are part of the new behavior. Some people have really felt that they're not even thinking well. I sometimes feel that I'm in a video game myself. I don't know what is real, what's not real. Everybody comes and everybody goes. The real personal connections are missing. We feel like we're not pulling our weight. We could be an imposter. We feel like we have no choice. And then, of course, and that's the reason why we are all here today, is that there's a heightened level of stress, both personally and professionally. So I've tried to condense a lot of the challenges we are all facing over the past 6 months, and wanted to offer up a few tips to maintain a productivity that sometimes we expect a lot from us. So what is an expectation and what is reality? And I'll give you a tip. As a psychiatrist, I make the maximum amount of money by reducing people's expectation. I think we realize that most of us have high expectations of ourselves all the time, and the reality is that we probably won't be able to keep up with that kind of expectation. So reducing our expectation to sort of merge with our own reality. So if you know that there are our children needing our attention during a particular time, then we cannot offer that we will finish a project by that time. And then another very challenging aspect we need to think about is the fact that there should be some structure for you and your family. There should be some very difficult conversations you should have with your children and your spouse about your time and your own desk, which needs to be set up. A lot of people tend to find managing emails and messages very challenging during this time. I myself have forgotten that I have like 3 or 4 different job responsibilities, and I'm pretty good in 3, but the last one I'll forget because there is nothing to remind me that I have to check some messages from another server I should log into. So navigating those aspects are important. Burnout becomes an issue when you become cynical, when you have no more emotional capacity to react. You could be going through a certain sense of burnout. A lot of times, how we could navigate this particular time is to establish our connections with other people. I would call something called this concept as compensatory genius. So let's say you're an idea person and you know somebody else who's a great executor of ideas. Try to connect with them. We can't be everything all the time. So having great collaborators who compensate for your own personal weakness is another way to maintain your productivity. People talk about creativity, and I know that COVID time has brought out creativity in terms of like people bringing out TikTok videos, and we see all the times, celebrities now have podcasts, and John Krasinski created this great video series called So Good News, so on and so forth. So it is still a time for creativity. So we need to sort of put ourselves in that mode. And procrastination becomes an issue, distraction becomes an issue, but we have to still power through them. And as much as possible, maximize the motivation and engage in healthy habits if possible, because this is a time where people will lapse back, and I'll talk a little bit about it. So this is basically, I would say this would be the kind, if you came to me asking for a prescription, this will be in my prescription pad, 10 different things you need to do. Of course, this offers us an opportunity to sort of reorganize our own work patterns. It doesn't really have an impact on us who are going through really tough time, who've been in some way inundated by the pressure of day-to-day life created by the pandemic. And so the next section of my talk, I'm really going to focus a little bit more on the broader aspect of a humanity, and also looking at this from a much more from a positive psychology point of view. it is difficult to fathom that behind crisis there could be an opportunity. Uh, I think that if you look at any big events which has happened to humanity, which is critical and devastating, behind that there was still an opportunity to become focused on our own maturity and ability to reflect on life. So, what is maturity? So, according to Wikipedia, it is the ability to respond to the environment, being aware of the correct time and location to behave, and knowing when to act according to circumstances and the culture of the society one lives in. So, when we call somebody a mature person, this is a person who are able to navigate challenging scenarios, complex dynamics, and able to say the right thing and do the right thing despite what other circumstances might be. So maturity also helps us to have a clear comprehension of a life's purpose and which way we are headed, and intentionality, and so that we can feel that our life is meaningful. So Viktor Frankl was a psychiatrist who was in Nazi camps, and he realized one thing: people are overtly optimists. They died very fast because they just didn't know that they were in for the long haul. And so he had to reorganize himself, and he had to ask himself what his meaning of life is. So challenging the meaning of life is the truest expression of the state of being human. Quite a lot of times we've been lulled into comfort, we've been lulled into complacency. We never had to sort of brush against a disaster of this magnitude. So despite the impact of it, this will give us an opportunity to ask ourselves where our life is headed and how intentional are we in living our lives. So the other aspect of maturity is that it helps us to make choices. Like I said, we have a kind of driven in a kind of a straightforward path with no detours, but now we have come to significant roadblocks where we are forced to take detours in our lives, and these are important because then we can exercise freedom to make choices. And Viktor Frankl again says, everything can be taken from a man, but one thing, the last of the human freedom to choose one's attitude in any given set of circumstances, to choose one's own way. So Dr. Frankl, who survived the Nazi camps, came out of this particular experience really armed with the theme that what gives life strength and what gives us the purpose and what keeps us alive is that we have to search for meaning of our lives. And meaning of our lives differ for each and every one of us. And we'll talk more about that in a second as we strive for our own sense of authenticity. One of the most fascinating studies which came out in the last 20 years is the fact that people will grow after trauma. Quite often we have this notion in our head that once something traumatic happens to somebody, they are destined for a certain degree of decline in the potential and possibilities. But a theory called post-traumatic growth is a theory that there is a transformation following trauma. And the people behind that theory is Dr. Tedeschi and Dr. Kalun. And they said that people who endure psychological struggle following adversity often see positive growth afterwards. According to post-traumatic growth, people develop new understanding of themselves, the world they live in, and how to relate to other people, the kind of future they might have, and a better understanding of how to live life. So this is something we have to be inspired by, because we have our own kind of a notion of that trauma is so devastating that nothing good could come out of it. But post-traumatic growth theory says that we could be surprised by what could follow this. So what will happen after a trauma is that we could develop an appreciation of life, we could enhance a relationship with others, we could see new possibilities in our life, and we could derive further personal strength, and we might go through a spiritual change. So this is aspects of post-traumatic growth. Along with that is this time for reflection. Something I have noticed myself that because my commute got in some way axed because I could stay at home and continue to serve my patients. And in terms of social outings, they also stopped. So with the normal routine and most of our social life on hold, we could have a chance to reflect upon questions and mature through the experience, some of these questions. So reflection, without reflection. So some great man said, I can't remember the name, that an unexamined life isn't worth living. So we could live life on autopilot, or we could examine our lives. Now, a lot of things what we do in therapy, when a patient comes to us and sits down with us and talks about their lives, or a life and all the events that happen, we are in the process of reflecting along with the patient. And sometimes these reflections are not easy. Some patients don't want to talk about it. And so they kind of talk about trivial things, eclectic things, esoteric things. They never get to the point. It's up to the therapist to bring the patient close to the cardinal aspects of their lives, so we can reflect on them and grow. So reflection is not easy, and reflection could bring in pain, but reflection helps you experience life at a deeper level of awareness. And so in the face of crisis, we have to reconsider our current sense of reality. And I have to say that I had to also change my own assumptions about the world. And I had no idea how my daily life could be challenged as well. And so our future right now is still yet to be charted. So we still don't know how our future might be. And maybe it will force us to create new goals, which will fit a new reality. So I am an educator, and I enjoy standing in front of my students and delivering a talk. Right now, my reality is that all I can do is to hope that my students will keep the cameras on, so that I could see the faces. And quite often they defy me, and all I see is is a blank space with a muted microphone. So this is my reality, and I have to get used to it. So this is something about getting ready for change. So like I talked to you about post traumatic growth theory, I also wanted to tell you about a self-determination theory, which was actually invented close to where you are. It was invented at University of Rochester. That what they found out that there are three basic needs for all humans. And if these needs are satisfied, then we all can have access to optimal growth. What are those three basic needs? These needs are competence, relatedness, and autonomy. And I'll talk more about it in the coming section. So competence is this desire in each of us to experience ourselves as capable and effective. So when you are prevented from developing your knowledge or skills or mastery, then the need to be feeling competent will be unmet. So when we feel incompetent, we are less motivated to initiate the required work. And then this feeling of incompetence and low self-esteem make people believe that they're unworthy or unlovable. So constantly in your own space, try to see whether you're doing your best to bring out the most competent part of you, and same with your co-workers and your subordinates, that you have to inspire them to feel competent. The other aspect of the human need is this need for relatedness, this desire to feel connected to others and to be treated as a respected member of a social group. And I enjoyed the chit chat and the banter which went about in this conference prior to people coming in around 12 noon. And that shows that easy connectedness all of you share. And that is a very important part of our sense of well-being as well. And the final part is what we call autonomy, the experience of being in charge of one's action. So it has to be done through our own choice and willingness, and we should not feel that we are forced or compelled to do so. And when you feel that you're doing certain things out of your own will, you're fully engaged, and we can fully exploit our talents, abilities, and energies. So there is a report saying that self-employed people are more satisfied with their jobs than employees because it gives them autonomy and flexibility. And your industry is a perfect example of autonomy, where you can set your schedule as much as possible. You have time for your creativity. You can bring in talents in terms of connectedness to people, relatedness to people, your own collaboration with other aspects of selling and buying a home. So in a way, it talks about our three basic needs: the need to be effective in dealing with an environment, that is competence; need to control the course of our lives, that autonomy; and need to have close affectionate relationship with others. So this is our three basic needs. So once we have these three basic needs, it engages us, motivates us, and it creates enhanced performance and improved persistence and creativity. So this is very crucial part of our life. So we have to examine whether we are at a complete state of autonomy, how related we are to our colleagues, and how competent we feel. So Viktor Frankl again says, when we are no longer able to change a situation, we are challenged to change ourselves. So again, it's time for us to, rethink ourselves about who we are and how we have to force ourselves to change. So here is a story of somebody who never picked up mail, and this person is nobody but me. I would keep mail in my mailbox for months. Have you heard of such a psychiatrist who is scared of picking up the mail? Actually, this is supposedly actual psychological condition where we just don't want to see some kind of a bill we didn't anticipate, maybe a kind of letter from the ARS. We anticipate all that. So what happened is that I didn't pick up mail for 2 months. The mailman got very angry and he removed all the mail. And I was leaving notes for the mailman all over the apartment complex. Please, have you seen the mail? So each of us have our own sense of, I would say, unique fears, which we have irrational ways of confronting it. So one of the things I wanted to talk about is fear. Fear is extremely paralyzing. Fear limits our agency to be effective. We know this fear is irrational. I should know that there's nothing big about going and picking up a mail, but it also can pulverize the self-esteem. And during the times of uncertainty, that's when fear is worse. So the other theme I want you to talk about is that a lot of times we are most successful when there is a complete merging of a currently, where we are currently and where we are in the future. So let's say we don't care about our future self. So we spend all our savings, we use alcohol, we smoke, we indulge in destructive relationships, and don't exploit our talents. Then there's a huge disconnect between the current self and the future self. But we really care about a future self, then we are going to do everything possible to make a future self be healthy, more content, be in good relationships, financially stable. So this ability to merge the current and future self provides the best outcome. But when we have fear, it destroys the connection between a present self and a future self. We can't even see the future. We can't even anticipate that much. So what happens when we get scared, when we get anxious, we go what we call the downward spiral of depression. So negative experiences like a disaster, the pandemic, leads to negative thoughts and feelings. Then there are further bad news, which reinforces the negative processing. We end up setting much less kind of formidable goals. There's a lot of, we become, maybe we become homebound and we don't do much. We have no expectations about the future, and then results in lots of negative thinking, negative feelings. So this is called the downward spiral of depression. And even a small event to a large event, we don't know what might set it off, but then it sort of spirals and takes a life of its own. So this is it's a very, I would say, commonly seen phenomena in my patients who are depressed. So one of the themes is that, so the way to confront is activity. So I would say action is the antidote to activity. We have to do something, anything. So the other way to people talk about is what we call behavioral activation. So once you do something, you feel a little bit better. You do something else, you feel even better. So you can break that downward spiral by doing something, by being active. So to act, we may still fall into what we call action traps. Okay, we could procrastinate, or we could catastrophize, saying that nothing good is going to happen, or we could be fatalistic, saying this is what it's going to be, there is nothing I can do to change it, or we are paralyzed by the fear of failing. So to prevent that, you could do few things. It's called action strategies. You could write it down. You can make a list. Today, I'm going to just go up to the mailbox. I might open it. I don't want to take it, or I'll get a big bag so I can collect all the mail, or I'll take the trash can, go there so I could throw away the unnecessary mail, something like that. Or you could break it down and we can identify the first step. Sometimes you could get a friend to come along with us if you're not able, or we could employ a coach. There are coaches are willing to coach you through a difficult scenario. And if you are that bold, you can also commit your intention publicly. And that way, there are people waiting to hear your progress. One of the key things I want to keep on emphasizing to you is self-care. There is a lot more demands on our own health or our loved ones' health during this time. Our work structure has changed. There are significant staffing shortages, which makes us do more work than usual. We worry about the health and safety for ourselves and a family. And it's a time we experience significant anxiety, stress, and insomnia. So this is a time for self-care, but it's very hard to make it practical. So I wanted to also point out that there is this concept of war that which will help us to sort of navigate this extraordinarily confusing times. So like I said, it's very hard to keep so many advice we get from leaders in the field, thought leaders, and as I said, celebrities. Everybody is in the business these days about giving us advice. What can we trust? So I think the way I would suggest is that we go back to timeless universal principles where people have sort of seen certain things continue to work over different circumstances and different time periods and have stood the test of time. So one of the themes I want to point out is virtuousness. Quite often under stress and crisis, we tend to, we have this tendency not to push towards the highest level of, I would say, virtue we could summon. And so what we do is that we tend to slack off or we cut corners. So if you're virtuous, we won't do that. And virtuousness can be about courage. It could be about humanity. It could be about justice. It could be about wisdom and knowledge. So all these things are virtue. So again, profile in courage, Rosa Parks. So courage is feeling the fear, but doing it anyways. And what they have noticed, post September 11 in 2001, people and companies have done virtuous things, continue to outperform other airlines. And companies which has virtuousness as the major mission tend to recover faster from downsizing, and it leads to significant recovery from setbacks. So what I'm saying is that let's say you do something good, it amplifies another good action, virtuous action, and then it leads to a company feeling more virtuous. And then if trauma happens, and that potentially can lead to negative outcomes. But if you're a virtuous person and a virtuous company, this acts as a buffer towards any negative outcome. So it's good to be virtuous. And this is a story about Gandhi. So when Gandhi was leading a small group as a demonstration of salt war, what happened was the British wanted to squash that small group. So they were a little bit harsh to the group, but Gandhi responded that nobody should fight back. So it looked like Gandhi lost that whole movement, but newspaper reporters saw how terrible the British had acted towards this group of non-violent followers of Gandhi. They wrote about it. And so that particular event, although it was an event of defeat for Gandhi, became an event of moral victory, which became the first, I would say, turning point in terms of India's struggle for independence. So when you're virtuous, you can actually bring out amazing results. The other concept I want to talk about is authenticity. This we tend to forget under crisis. We forget our story, we forget our values, and we even forget that we have a voice. So how do we become authentic? That becomes a problem. Who am I? And there's a small chart I could say is that whenever you want to think more about yourself, you have to go back to the people who shaped you, who had an impact on you, and look back on moments you say, this is the real me. For example, I would say for me, connecting with all the wonderful people, I enjoy that process. Talking about subject material to my residents, that's where I am. So although I have an MBA, I have not really exploited that kind of a business degree to pursue high positions in organizations, which at some point in my life I could have had a chance with it, which would have definitely enhanced my earning potential, so on and so forth. But I've chose a career in academic medicine, which pays much less than a private practice, because I think this is where I am at my authentic best. So all of us have chosen certain careers and certain positions and certain locations and certain stations in life because it may be the most authentic aspect of who you are. So trying to look for our own authentic spirit is very important. But even when we try to be authentic, we are also confronting shame and guilt, and we all are, I would say, victims of what we call perfectionism. You know, we want everything to be perfect, and when some certain things go wrong, we get very upset, we blame ourselves, we are filled with shame. So a great author called Brené Brown writes that we cultivate love when we allow our most vulnerable and powerful selves to be deeply seen and known, and when we honor the spiritual connection that grows from that offering with trust, respect, and kindness and affection. Shame, blame, disrespect, and betrayal, and the withholding of affection damages the roots from which love grows. Love can only survive these injuries if they're acknowledged, healed, and rare. So we have to be open to our own sense of vulnerability. So how do we return to our authenticity? We have to practice courage and reach out to people, talk about them, talk about our story. And most importantly, we have to talk to ourselves with self-compassion. And I'll talk about that in a second. So this came out in 2001. These are the whistleblowers. This three women, all of them were breadwinners to the family. By being whistleblowers, they were almost going to be ostracized by the whole community, and they might even have potentially they could have no more livelihood because people would think that they are not good people to employ. But they had the courage to stand out, and they believed in their own voice. So altruism, the other aspect, is that it's about selflessness. It's about the principle which keeps others' well-being a priority. So what is altruism driven by is empathy. Empathy is the ability to understand and share the feelings of another. So I think that's very important, that we need to know who other person is. So this is Lady Diana. She actually did a lot to enhance the world's stigma against, enhance the world's acceptance of AIDS patients. And just by showing her empathy, she transformed the way the world saw patients with AIDS. And part of the brain which helps us empathy is called mirror neurons. And a lot of us actually we learn through imitation, and neural imitation could be another neurobiological correlate of empathy. And kindness is in all of us. We are wired to care. And in a book called Survival of the Nicest, author Stephen Klein says altruism is a defining character of humans. So when we were going through our early phases as hominids or early humans, we cooperated in groups, and then we survived. And once we survived, we were able to devote time to developing language and intelligence and culture. So in this book, Dr. Klein writes, we humans became first the friendliest and then the most intelligent apes. So being friendly and being collaborative, be altruistic is a key to survival. When Japan got hit with a bad tsunami and a nuclear reactor was damaged, these 50 people went in to clean up the whole debris, so on and so forth, knowing that they would probably be hit with radiation and could potentially die. And they were called the Fukushima 50. So they are the highest of altruism. And most of us in life are either givers, matchers, or takers. And if you look at it, success depends on people who are giving to others most, and people who are takers and matchers. They are, less successful than the givers. But if you give too much without any sense of who you are, then you won't be that successful. So givers are those people who give energy, who creates opportunities, and the takers among your friends and colleagues who suck your energy, who are what we call energy vampires. They keep talking and talking, and you wish they would shut up. They are called the takers. But most of us are actually matchers. We take a little bit and we give a little bit. So to be the best, we have to be givers. Givers pay most attention to what others need from them. And then Adam Grant says, you should craft your job so you can give more. And what is amazing is that, and which I try to do these days, is that, someone may ask you for a favor. Someone may ask you, hey, can you give me the contact number for this person? Or can you speak for me to this person? It might take less than 2 minutes, but practicing that 5-minute favor does a lot for that person. And also, you can also seek for help in other people because people love to give as well. The other concept I want to sort of, my last section of this conversation with you is about resilience. That, every human being is resilient. Every human being has a capacity to bounce back, to spring back from adversity. And these people who are called resilient, they take responsibility for this. And quite often, two people can experience the same phenomena, but one person can have a better empowering interpretation and also could have meaningful connections and will make an attitude change so they can move on with their lives. So resilience is very much a birthright. And in childhood, if you have a long and supportive environment, positive relationship with others, very productive romantic attachments, all these things help us. And then when you become an adult, you become optimistic, you have an active coping strategy, you have a sense of autonomy, you are more motivated, you have secure attachment, you trust more people, you have strong social skills, you have great self-confidence. So all of this is about creating a resilient attitude. So I created what you call a ring of resilience. Resilience is not just one emotional aspect or psychological aspect. It has a social component. I'll tell you about it. It has a physical component and spirituality as well. So in terms of psychological aspect, quite often when bad things happen to us, we have to process what we call a cognitive reappraisal. It is about, looking what really happened, whether any chance of, reappraising this for looking for any positivity which may come out of it, looking for meaning and looking for coping strategies rather than avoiding this whole coping process. One of the themes I want to bring up is something called self-compassion. We are very critical of who we are. We are most, in a way, least forgiving of ourselves. You have to practice self-kindness. That's part of self-compassion. And also we have to realize that there is a common humanity behind all of us. Most people we meet are going through the same challenges that we are. And that's very important as well. And then it also helps us to be mindful, to realizing that when we are stressed, that we should realize that we are struggling, but we should do it in a non-judgmental way without reacting. So mindfulness is paying attention on purpose in the present moment, non-judgmentally, and it helps us for stress, for anxiety, helps us with sleep difficulties, and also combat burnout. Some people say even a very informal thing like hand washing or washing the dishes, even doing it in a very rhythmic and ritualistic and mindful manner is a good process of mindfulness. And right now, tons and tons of apps are available, like Headspace and Calm, where we can get great opportunities to meditate and be mindful. This is a group of policemen in Bombay, India. I love this. They're all practicing what we call laughter yoga. And it's also using humor as a way to bring out the best in us. And I also wanted to point out that this is a time where we have really abandoned our social connection, but we have to realize a social network shapes us and our friends affects us. And our friend's friend can affect us. So this network, our social network has a life of its own. So here, if you see, if you have a nearby mutual friend, that means that you have a friend, you are their best friend, and they feel you, you are the best friend and they are your best friend. So you feel your best friend and they are happy. If they're happy and they live within a mile of your house, your chance of you becoming happy is much higher. That is the power of a happy friend living close by. And this has been proven in many studies. And physical activity is very important because it improves our physical health, mental health, and helps us with the weight. And it also improves our brain functions, attention span, decision-making skills. But right now we are moving less, we are tied to the desk, we have reduced work hours, we don't go out. We do less on the weekend. So these small decreases of physical activity add up to make us feel deconditioned. So we have to make up for what we call a movement deficit, right? We don't move. So you have to plan activities ahead of time. You have a set goal, even walking 30 minutes, and motivation is very difficult. So I had a good time during springtime, but when summer came, I stopped walking, and I'm really suffering because of the lack of that. So motivation is a big deal here. I'm putting up this fancy slide, but it's so hard to do it. So I'm just being very honest here. But that, as I said, it enhances mood. So a lot of times people are mildly depressed. Now doctors are saying, if you just exercise, is better than taking medication with bad side effects. So this definitely improves our brain function, improves us. We have what you call happiness to runner's high, and other ways to active is to walk, clean out, dancing, playing, choosing the stairs, now the elevators. And I just wanted to sort of talk about, eventually there's a concept now in psychology called flow. It's being carried away by an outside force, moving effortlessly with a current of energy at the moment's of highest enjoyment. And people talk about it. And this is very hard to even imagine that we can be, experiencing flow when things look so bad outside but I think this is what we have to aspire for. We have to sort of ask ourselves, when was I last in a flow state? When I completely immersed myself in a activity which I didn't care about the time. I was so immersed in it, I enjoyed it. And people are helping people to find what you call a flow state, so then we could feel good about ourselves. So a flow happens when whatever challenge you're facing matches your skill set. So as you could see, if you have no skill and you're facing a high challenge, you're going to get very anxious. If you have a lot of skills but your challenge is very low, you can get bored. But if you match up your skills, so you have a high skill level is meeting a high level of anxiety, you're in what we call a flow state. So what does it mean to be in a flow? We feel our goals are clear, we have great concentration, we are fully present, we have no ego about it. We are happy to work on for many hours. We're not worried about what the compensation is going to be, because we just enjoy being it. That's what it means to be in a flow. And in a book on emotional intelligence, Daniel Goleman says, flow is a state of self-forgetfulness, the opposite of rumination and worry. In this sense, moments of flow are egoless. Paradoxically, people in flow exhibit a masterly control of what they're doing. Although people perform at their peak while in flow, they're unconcerned with how they're doing, with thoughts of failure or success. The sheer pleasure of the act itself is what motivates them. So this is all I have for you this afternoon. All I was trying to do was to prove that we're all in it together. We are in uncharted territories. We haven't figured out how to navigate this well. But I think if we believe in ourselves and our own authentic spirits, and take some time to ask ourselves about things which are meaningful to us, and also make small steps to counter our own irrational fears, and use the power of our community and a family to make us stronger, I think we are on to a great start. Things are still going to be difficult, and we have to be realistic about it. But I think together, we put our heads together and our minds together, and we support each other, and we become altruistic. We have a better chance of navigating this crisis better than anybody else. I wish you all well, and thank you.
Thank you, Dr. John. Thank you very much. We'll just take it back. I don't know if Dr. John, if you're up for any questions.
Sure, we have a few minutes. I have another meeting at your 1 o'clock, but yes, I'm glad to comments or questions, anything. I can take anything.
Hey, Dr. John, this is John. First of all, thank you. This was very eye-opening. How does one deal with the fear of just living during this pandemic? I understand, exercise and being more cognizant of yourself, but sometimes people get such so depressed and in a funk they can't see that where they are. How does one deal with that?
Right, John. So that's a great question, and I think quite often this is where I think a lot of my own specialty comes into play, because quite often people tend to expect them to just get up and do what they're supposed to do. It's all we call that. You need to have a positive mentality. You need to have a strong personality, strong character. But John, the way you're describing it, I'm worried that that particular kind of a syndrome might have lapsed into at least a mild form of depression, and they may need to seek the care of the primary care doctor. Sometimes a therapy would work. Sometimes a low dose of an antidepressant would work. But because I think the way we differentiate it is that if your functionality is in some way compromised, then you need help. And we cannot help ourselves. In terms of mental health, we cannot help ourselves when we cross over into that state of decline in functionality. We need experts to help us. Maybe, right now there are experts who can talk to us through the phone. Maybe that may be the most, I would say, least, challenging of interventions, but you really need to be serious about it, because it could lapse into worse states of depression and anxiety and completely paralyze you.
Thank you. Well, I have another question since no one is raising their hand. I think it's important for managers to recognize stress in the people you manage. Sometimes we go about our day to day and we're trying to get back to business as usual. But as you saw on the slides, there are a lot of hiccups along the way, and some of your own people may not be able to deal with the stress, and you have to be aware as managers to get them help.
John, that's a great point. And I forgot to sort of mention it or emphasize, so thank you so much for bringing it up. One of the ways you could do is what we call virtual check-ins. So I talked to a hospital leader. What she would do is that every morning they have a small huddle for 15, 20 minutes. And everybody keeps their cameras on, and then they just go around the room saying, how are you doing? How are you doing? May not be much. Sometimes people come up with a poem or a small reflective piece. It doesn't really matter, but at least the fact that we are connecting on a daily basis helps. And this particular colleague of mine, she decided, I don't know for what reason, not to have a camera on, but she was available on the audio, but there was no camera. Then people started texting her, are you okay? Are you okay? Because I think having that, we are very visual people, and having a visual representation and seeing the emotions in some way reflected back to us is so soothing and healing. So we can't give up on that. So having a virtual check-in with your team, even twice a week, thrice a week, whatever is possible, is very powerful. Then you will see who's progressively activated, engaged, and who's becoming withdrawn. And you may want to call that person privately and see how they're doing. So this is very much part of team building. And there's a lot of, I would say, invisible issues we are not confronting because we're not seeing them day to day in the office. So thank you, John.
Anybody else? Dr. John, on behalf of President Littlefield and the leadership team, and Kathy for organizing this. We're not done because Donna has other things we're going to talk about, but Dr. John, thank you. So much appreciated.
Thank you again. Thank you so much. Take care.
Thank you, Dr. John. Don't leave, guys. Stay for a minute. Where'd John? Oh, there's John.
I'm gonna stop recording at this point, though. All right.
Okay.